Imagine this for a second. You're in a job, maybe a really high-stakes one like medicine, where, decisions matter a lot. And you're told there are systems, checks and balances, all designed for safety, for improvement, for accountability. Sounds good, right? Necessary even. But what happens if those systems, the ones meant to help, actually start to feel, well, threatening, like they could be used against you?
Yeah, that's not just a what if. It's the core issue explored in this really fascinating paper we're looking at today. It's titled Focused Professional Practice Evaluation and the Weaponization of Anonymous Reporting. Erosion of Care and Fairness. Quite a title.
It really is. And our mission today for you listening is to unpack this. We want to pull out the key findings, think about what they mean, not just in medicine, but maybe more broadly too. And importantly, we'll look at the study itself, what it did well, and maybe where it has limitations, give you the full picture.
Right. And to really get why this is such a big deal, you need a little context. These systems didn't just pop up overnight. There were these really awful cases like Christopher Dunch, Dr. Death, things like that forced a change in how hospitals watched over doctors.
Absolutely. So back in 2008, JCAHO, that's the Joint Commission, brought in things like FPPE, Focused Professional Practice Evaluation, and also anonymous reporting systems.
And the idea behind them was, honestly, noble. It was about patient safety, helping doctors improve, giving staff a way to speak up without fearing backlash. A safe channel.
A safe channel, exactly. But here's the kicker, the big question this paper tackles. Are these systems actually achieving those noble goals, or has something gone wrong along the way?
That's precisely it. The paper highlights this gap. We intended for these systems to improve safety, but we haven't really checked if they are. And worse, there's this growing unease, this feeling that maybe they're being misused, maybe even weaponized against doctors.
So the researchers wanted to investigate that directly. Is patient safety actually declining because of these systems? Are they being weaponized? And their method, they went straight to the physicians themselves. They designed a survey.
Yeah, a 29-question survey. They ran it earlier this year, February to March 2025, reaching 152 surgeons across the U.S. It asked about their experiences, with FPPE, with anonymous reports. Did they think it was fair? Did it affect their careers? And crucially, did it change how they actually practice medicine?
And getting participants, how did they do that? The researchers themselves are spinal surgeons, right?
They are. So they use their networks, personal emails, LinkedIn, a big WhatsApp group for spine surgeons. Though for the WhatsApp group, they mentioned focusing just on the U.S.-based doctors to keep the results focused on these specific systems.
Okay. And who responded? What did the group look like?
Well, it skewed a bit towards the investigator's specialty. About 55% were neurosurgeons. Most were very experienced, over 3/4, had more than 11 years in practice. Slightly more were in academic hospitals. Demographically, mostly male, mostly white. The authors acknowledged this focus, but believe the findings could apply more broadly.
And how did they analyze all that information, the survey data?
It was a mix. For the yes-no or rating scale questions, they used percentages, looked for statistical patterns, but they also had open-ended questions, and they coded those comments thematically, pulling out direct quotes. That's where you really hear the doctor's voices.
Okay, let's get into those findings then, because you said they were alarming.
They really are. I mean, the overall feeling about these systems, overwhelmingly negative. Get this, only 6% felt FPPC was actually effective and positive for patient care. The average rating was just 2.23 out of 5. Pretty dismal.
Wow. But here's something you mentioned that really struck me. It wasn't just the doctors who'd been reported who felt this way.
Exactly. That's maybe the most critical point. Nearly 20% of the surgeons surveyed had never been formally reported through these systems. Yet, they described the exact same negative trends in care and culture as those who had been reported.
So it's not just sour grapes from people who got flagged. It suggests the system itself, or maybe the fear of it, is the problem?
Precisely. It points to something systemic. And the impact on patient care. It's profound and, frankly, often seems counterproductive to safety. Over 70% said these systems made them practice defensively, delaying things, ordering extra tests, maybe not clinically needed, just to, cover themselves.
And avoiding risky cases. That seems huge.
It is. 57% admitted to avoiding high-risk cases, specifically because of these systems.
Think about what that means for patients. The ones who need complex surgery, the really challenging cases, they might just get turned away. The paper even had quotes like, high-risk patients turned away, and no one does complex cases. That's a serious access issue.
It absolutely is. And it goes further. Some doctors reported feeling pressured to, say, overprescribe pain meds or sedatives just to avoid getting an anonymous report about bad pain management. One doctor even told a story about a patient death that happened because another provider gave in to that kind of pressure. Direct harm.
That's horrifying. And what about the team dynamic? In surgery, collaboration is everything, right?
It's supposed to be. But nearly half, 45.5%, reported that these systems eroded camaraderie in the operating room. Trust went down. And almost 70% saw a shift towards blame instead of collaboration. You see quotes like, pit services against each other, no collaboration. It fractures the team.
And the irony, a system for safety making people afraid to report actual errors.
Isn't that something?
Yeah.
Even the unreported doctors pointed this out. They said the system leads to failure to report errors and near misses because everyone's scared of punishment. When your safety system makes people hide mistakes, well, that's fundamentally broken.
Okay, so patient care suffers. What about the doctors themselves, the impact on them personally?
Also devastating. Nearly 60% reported more stress and burnout. A massive 85.6% linked FPPE directly to burnout, with over half saying it was a significant factor.
85%. That's enormous. It feeds right into the physician shortage discussions we're always hearing about.
Exactly. And it's not surprising when you see that almost 60% considered leaving medicine or at least simplifying their practice because of this stuff. The comments here were just brutal. Things like fired, career ended, mental health collapse, sham review ruined me. These are livelihoods, lives being destroyed.
And the fear you mentioned earlier, the fear of speaking up.
Palpable. Many doctors felt they couldn't raise legitimate safety concerns, especially fearing retaliation from nursing staff, potentially through these anonymous reports. It creates silence. There was even one story about a doctor getting fired after reporting issues, supposedly to protect another doctor the hospital had a financial interest in. It suggests power dynamics are definitely at play.
It sounds incredibly stressful. Did it go beyond stress and burnout?
Sadly, yes. The paper mentions personal accounts of deteriorating work culture, ruined careers, emotional distress, and even suicidal ideation.
What?
I mean, there's a quote about a colleague who attempted suicide after having his privileges taken away without cause for over a year. The human cost here is just immense.
Which leads right into the whole question of fairness, doesn't it?
What?
How did the doctors perceive the fairness of these systems?
Not well. Over 69% of those who'd been reported, and still over half, nearly 54% of those never reported, called the system unfair in some way. And get this, less than 6% overall thought the reports they knew about were completely fair. Tiny fraction.
Why? What made it feel unfair?
A lot of things. Lack of due process was a big one. Over 62% said the rules were applied inconsistently. It wasn't clear how things worked. Over half mentioned a lack of transparency when they tried to dispute a report. It felt like a black box.
And this leads to the idea of sham peer review.
Exactly. That term came up a lot. The feeling, as one doctor put it, was, once reported, one is guilty before being proved innocent. Actions could be taken based on reports that weren't fully checked out, and the burden of proof seemed flipped. Remember that example. The surgeon reported for too many images on one case and not enough on another, with no look at whether the patients actually did well.
Right, the impossible situation. Damned if you do, damned if you don't.
Precisely. And there's no accountability for the person making the report. Often, they don't have to be proven right for the reported doctor to suffer consequences. There was also mention of a specific dynamic sometimes where nurse managers might encourage reports if they felt their staff were being questioned, creating this feeling that the doctors fear the nurses' write-ups.
So let's try to connect these dots. What are the bigger implications here, beyond just the survey numbers?
Well, the paper talks about cognitive biases, like hindsight bias. It's easy to criticize a decision after, the outcome was bad. And this aligns with the findings. Nearly 80% felt FPPE was subjective, and 2/3 felt it was misused. It starts to look less like objective review and more like outcome-based punishment.
Which, as you said, feeds directly into the workforce crisis.
Absolutely. The AMA talks about workforce anemia. Well, if 85% of surgeons link these systems to burnout and 60% think about quitting over it, this is a major contributor. We're losing talent.
And the irony is just staggering. A system meant to reduce fear of speaking out has just shifted the fear onto the doctors themselves, to the point where the AMA is apparently drafting laws to protect doctors from retaliation for raising concerns. That tells you everything.
It really does. And fundamentally, it just seems to break relationships. Even if you haven't been reported, that atmosphere of suspicion, of blame over collaboration, it undermines the teamwork essential in medicine.
Okay, it's a powerful indictment of these systems. But we promised to look at the study itself. What were its strengths? What makes these findings credible?
Good point. Well, first, it's timely and relevant. This isn't some obscure academic issue. It's hitting doctors right now. And it gives voice directly to the people experiencing it, the surgeons. It's their perspective, unfiltered.
And that point about including the unreported doctors seems really key.
Definitely a major strength. Yeah. That finding that even those not targeted feel the negative effects strongly suggests it's a systemic issue, not just individual complaints. The threat alone changes behavior.
What else?
The mixed methods approach, combining the numbers with the qualitative quotes, gives a much richer picture. You get the scale and the human impact. And, it went through ethical review by Pearl IRB, which adds a layer of procedural soundness.
All right, fair enough. But no study is perfect. What are the weaknesses, the limitations we should keep in mind?
True. The biggest one is probably that it's all based on self-reported perceptions. These are doctors' experiences and feelings, which are valid and important, but they aren't externally verified instances of misuse documented by the study itself.
And it's only the doctor side of the story, right?
Exactly. It's a physician-only perspective. We don't hear from nurses, administrators, patients. They might see benefits or have totally different views. It's inherently one-sided in that respect.
What about how they found the participants, the convenience sampling?
Yeah, that's another limitation. Using personal contacts in specific groups means it wasn't a random sample of all U.S. surgeons. So generalizing the findings needs a bit of caution. Though, again, the authors argue that consistency between reported and unreported groups helps offset this somewhat.
Could there be response bias, like maybe the angriest doctors were the most likely to answer?
It's always a possibility with surveys like this. People with strong negative experiences might be more motivated to respond. The authors acknowledge this, but again point to the unreported group's similar responses as a mitigating factor.
Anything else?
Well, the study itself notes how hard it is to objectively tell the difference between a valid report about a real problem and a report that's, weaponized or retaliatory. It relies on subjective accounts. And finally, the demographics. Mostly experienced neurosurgeons. Their experience might not be exactly the same as, say, a junior doctor in a different specialty.
Okay. So, summing it all up, what was the paper's final bottom line conclusion?
It's pretty stark. They conclude that FPPE and anonymous reporting, despite the good intentions, have largely devolved into systems that are causing a net decline in patient care and safety, leading to actual patient harm, harming doctors' mental health, and messing up careers.
And they're calling for urgent reform.
Absolutely. They say it's crucial to restore quality and protect what they call an already diminishing and overworked profession. It's about the sustainability of healthcare.
Did they offer specific ideas for reform?
They did. Things like finding ways to make the process more objective and fair. Maybe having a multidisciplinary panel screen reports first to filter out frivolous ones. They also float the idea of de-anonymization, making reporters accountable. But they acknowledge the potential downside of that leading to retaliation. It's tricky.
Any other suggestions?
Yeah, exploring things like using blinded AI in reviews, maybe. And definitely calling for a bigger, broader study to confirm and expand on these findings. In fact, they directly ask any physicians listening or reading to share their own experiences, good or bad, in their ongoing survey. The link's in the paper if you want to find it.
Wow. It really leaves you thinking, doesn't it? We value transparency, we value feedback for improvement, but how do you build systems that actually do that? How do you foster safety and growth without accidentally creating tools that generate fear and harm?
It's the million-dollar question, isn't it? Balancing accountability with trust. This paper certainly suggests that maybe, in this case, the impact of the system hasn't lived up to its intent.
Indeed. And it makes you wonder, how much of this applies elsewhere? Think about corporate reviews, academic evaluations, any field with feedback systems. Could similar dynamics be playing out, where the system itself inadvertently damages the very things it's supposed to improve? Definitely something to mull over.